Hello, we are group number 2 presenting on the public health response to COVID-19 at the local level in New York City. The group members consist of Lillian Nguyen, Nyat Pham, Quinn Nguyen, and Tao Nguyen. Hi, this is Lillian Nguyen, and I'm going to be talking a little bit about what COVID-19 is. So COVID-19 was first identified in Wuhan, China. COVID-19 stands for Coronavirus Disease 2019. It is commonly known as a mild upper respiratory tract illness, but there are many types of human coronaviruses. However, this strain is new, novel, as it has not been previously seen in humans. According to the Centers for Disease Control and Prevention, also known as the CDC, as of today, or as of this month, the United States has nearly 3.8 million confirmed cases, 141,000 deaths, and about 1.1 million people have recovered from this disease. In New York, 5 million people have been tested, and about 400,000 people have been tested positive. The area that has been mostly impacted would be near New York City, especially Kings County, where around 60,000 people have been tested positive. I'm going to talk a little bit about the assessments that New York City is doing through a plan that Governor Cuomo outlined that will help regions create individual plans based on facts and data to reopen New York. The loosening of restrictions in New York will be considered on a regional basis based on the following criteria: that the infection rate is sufficiently low, the healthcare system has the capacity to absorb a potential resurgence in new cases, diagnostic testing capacity is sufficiently high to detect and isolate new cases, and robust contact tracing capacity is in place to help prevent the spread of the disease. First, each region will have a control room team that will monitor the hospitalization rate, death rate, number of new hospitalizations, hospital bed capacity, ICU bed capacity, testing, and contact tracing within its regions during reopening, and alert the state if the region's metrics no longer meet the reopening guidelines and adjust the reopening plan for that region accordingly. Once a phased reopening begins, it is essential that the rate of transmission be carefully monitored and maintained under control. Each region must appoint an oversight institution as its control team to monitor the regional infection rate during the phased reopening. This team of local elected officials, as well as hospital and state representatives, will monitor the above metrics and other key indicators and can slow or shut off reopenings if indicators are problematic. This team will also monitor business compliance with reopening guidelines and ensure that local officials are enforcing these rules when necessary. Through monitoring new infections, they will analyze 3 metrics. The first is the decline in hospitalizations, the second is the decline in deaths, and the third is new hospitalizations. The CDC recommends that reopening will be dependent on a decrease in hospitalizations and infections over a 14-day period. Which again monitors the decline in disease trajectory, as it's possible for a region that has had high levels of infections to achieve a sustained decline in hospitalizations and deaths over 14 days, while still having infection rates that are too high to be able to safely reopen. Through the healthcare capacity, regions must have at least 30% of their total hospital and ICU beds available at all times. In addition, nurses and doctors are ensured personal protective equipment, PPE, that they need, so every hospital must also have at least 90 days of PPE stockpiled, as the regions can't afford to risk another scramble for PPE while medical personnel are left underprotected. Lastly, through diagnostic testing and contact tracing capacity and ongoing monitoring. Aggressive testing and tracing is very important to controlling the virus, as the hotspots can be quickly identified and isolated, which also allows for certain regions to monitor the rate of infections and adjust reopening strategies. Testing is key to effective contact tracing that would allow health officials to identify asymptomatic carriers who are spreading the virus undetected and isolate them before they infect others. Once the phased reopening begins, it is very essential that the rate of transmission be carefully monitored and remain under control.
Next, I will talk about policy development in New York State. One of the most essential services of public health related to policy development is to inform, educate, and empower people about health issues. In this service, New York State have done a good job in announcing and helping people to know about testing, spreading, and isolating. The New York City Test and Trace Code is a public health initiative to fight COVID-19 so that New Yorkers can go back to work, school, and help New York City to reopen safely. The COPE is a group of doctors, public health professionals, and community advocates working to reverse the COVID-19 outbreak and protect the city. It is important to mobilize community partnership and action to identify and solve environmental health problems in New York State. Technology SWAT team has cooperated with volunteers and professionals in different fields to accelerate and amplify responses to COVID-19. They are looking for impactful solutions and skilled tech employees to help. New York State have worked closely with Apple to fight COVID-19 by making New York-specific information on the virus available to New York users through Apple COVID-19 screening website and app. Focus on developing policy and plans that support individual and community health efforts. The Human-Centered Design (HCD) capacity building approach to support practitioners in accomplishing the goal of New York State creating healthy schools and community. Many reported personal feelings arose from frustration to empowerment, and there were a connection of importance of self-care during the pandemic. HCD offer opportunity for health practitioners to engage in small acts of self-care by providing space for them to share stories and support to one another. Virtual training start with self-care questions such as, how do you feel? How are you today? This approach has been especially helpful during COVID-19, not only for adults but also for children.
Next, I will talk about enforced law and regulation. Law enforcement personnel who make contact with individuals confirmed or suspected to have the COVID-19 should follow a distance of at least 6 feet. Practice proper hand hygiene. Wash your hands with soap and water for at least 20 seconds. Do not touch your face with unwashed hands. Have a trained emergency medical service access and transport anyone you think may have the COVID-19 to a healthcare facility. A single pair of disposable examination gloves, face masks are an acceptable alternative until supply chain is restored, such as N95 or higher level respirator, eye protection, disposable face shield that fully cover the front and side of the face. Next, I'm going to mention the importance of provide care in the pandemic. It is critical to provide a wide variety of service providers, especially for people with disability or people who are in need of medical advice. Service provided may include personal care, activity of daily living, access to a health service, and more. Encourage people who are at high risk to contact the healthcare provider or help them to contact the provider if assistance is needed. Follow healthcare provider guidance for standard and transmission-based precautions to protect yourself when providing care for people with the COVID-19. Recommend sick people to call the healthcare provider for medical advice regarding their own health issue.
Next is assure competent workforce. Assuring a qualified, competent, and healthy workforce is critically important to the overall functioning of a local health department and its ability to perform its statutory functions and deliver its services effectively. Assessing the public health and personal health workforce include the two followings. The first one is maintaining public health workforce standards, which includes efficient processes for licensing or credentialing requirements and use of public health competencies. The second one is continuing education and lifelong learning,
which include leadership development and cultural competence. The last step of assurance is to evaluate. Evaluate effectiveness, accessibility, and quality of personal and population-based health services. Evaluation must be ongoing and should examine the following: personal health services, population-based services, and the public health system. Evaluate also includes quality improvement and performance management.